Hey everybody, Dr. Barron here with virtualheadacheспecialist.com. I just dropped a new blog on visual snow syndrome and persistent migraine aura. This is a very interesting and infrequent thing that can happen, but it's something to know about because a lot of patients don't know what this is and they deal with this and they don't know what to call it. So I want to tell you a little bit about it today. So visual snow syndrome is where you get this old school TV static appearance. You can see here up on the screen to my left, this TV static appearance. This is one version of it. And then persistent visual aura is where you get this visual aura symptom, but it just doesn't go away. Normal aura lasts between 5 and 60 minutes, but for some people, they get the aura and it persists. It stays there. It doesn't go away. So you can imagine how intrusive this would be into life and function and driving and working and doing everything you need to do. Here's another view of this visual snow syndrome. You can see to the right of the screen, you get this staticky kind of snow appearance that's there all the time. It may not be as dense as the other picture I showed you, but it can be still very bothersome, obviously. So let me tell you a little bit about visual snow syndrome and persistent visual aura. And I will say, first of all, you can check out the blog. I'll leave the link in the feed. You can go through that. It'll go through everything you want to know about it, theories of why it happens, possible treatments, the testing you want to ask for. So check out the blog. You'll get a lot more info there, but I do want to highlight a few things. First of all, causes of this. There's a number of theories, one being abnormal neurotransmitter receptor activity in the brain, one being abnormal energy metabolism in parts of the brain, and the parts of the brain specifically is the occipital cortex, which is the back part of your brain. That's where your visual cortex happens. Abnormal sustained overactivation of the visual cortex, so part of the vision cortex is turned on, it won't shut off. A reverberating cycle of cortical spreading depression where it keeps stimulating itself, but the cycle won't shut off. Ultimately, we don't know. There's a lot of theories. We need a lot more research on this. There are a number of tests that should be done with this disorder. It may vary depending on the story and the symptoms, but the key thing is having an MRI and an MRA of the brain to look at the brain, look at the arteries of the brain, making sure there's not a stroke in the back part of the brain. The occipital cortex is one key thing you need to rule out. I also like to do an EEG. Rarely you can get occipital lobe seizure activity from the back part of the brain there. Lab work varies, routine labs, but I always like to do a hypercoagulability panel to make sure the person doesn't have an increased tendency to form blood clots. A detailed ophthalmology exam is mandatory. You have to see the eye doctor. You need to make sure there's no evidence for stroke in the back of the eyeball or some other reason from the eyes. Treatment of these disorders tends to be frustrating and tricky. It's usually a very resistant disorder. It doesn't respond well to a lot. So it's a matter of trial and error. Using different treatments that are targeting different pathways is key. Usually we start with the anti-seizure medicines, specifically lamotrigine generally is considered the first line treatment for this, but there's a number of treatments in the literature, case reports, the blog talks about some of these things. A good pair of migraine glasses, I did an earlier blog on good migraine glasses. Some people benefit from those. One treatment that's shown some benefit is neurooptometric rehabilitation therapy or NORT therapy. So check out the blog. I'll leave the link in the feed. Drop your comments and questions there. If you have found anything specifically that's really helped you with visual snow syndrome or persistent visual aura, leave them in the comments. There's a lot of patients suffering with this, so any information is good information.